Recent changes to a military health care program, and this covers nearly 10 million service members and their families, resulted in months of unpaid medical bills.
And Fact Finder has heard about a lot of these problems and how it also impacts the medical providers who care for these people. Fact Finder investigator Dylan Domingue joins us now with more.
Yeah, Mike, Rachel, that health insurance company is called TRICARE, and the challenges with TRICARE began at the beginning of the year when a new contractor began managing and processing those claims. As a result, medical facilities and clinics went unpaid for months. And while some of those payments have started to come in, many providers came close to dropping those military families as clients because of those unpaid claims, which was out of those families' control.
Feels like you're getting your head held underwater, really.
At the Ernest Hope Foundation in Wichita, 5 of their clients are covered by TRICARE.
We've got the speech, occupational, and physical therapies, and we also are a special school.
But for 2.5 months, Judy Power-Licklider, the president of the clinic, says they were not paid by the military health care provider.
For some children, if they're coming daily and getting some sort of daily service, and you're adding up those therapies over days and weeks or maybe months at a time, that the impact is really hard.
Since January 1st, the Ernest Hope Foundation has had 200 outstanding claims totaling more than $13,000. Those unpaid claims have made it difficult to provide full services and pay the staff.
Whenever any clients are behind in remittance, the impact can be kind of full sweeping whenever you're trying to make your ends meet.
Pollard-Licklider says her therapy clinic finally started receiving reimbursements from TRICARE in March, but they are still catching up on payments. But other medical providers that have TRICARE clients told Fact Finder they weren't sent reimbursements until last week. The Defense Health Agency, which oversees TRICARE, had previously said that their new contracts to process the claims would improve healthcare quality and access for beneficiaries. But medical providers argued it has had the opposite effect.
We do always have a big waiting list here. And so it would be really easy to say, you know what, your insurance isn't paying, and we got to get somebody else in here.
The Ernest Hope Foundation says while they have not had to drop any of their TRICARE clients due to the unpaid claims, it was a fear that they and other clinics had as the weeks and the months went on.
Our therapists aren't working for free. Had we gone another 4 weeks into that, we would have had to take a look at, okay, what are we going to do from here?
Now, the Defense Health Agency does admit that they have experienced many challenges since the start of the year, affecting thousands of families, including unpaid claims, outdated patient and provider data, and hours-long wait times just to speak with TRICARE. Now, in a letter last month, the Defense Health Agency said that several actions were being taken to protect TRICARE enrollees and improve phone lines so that you can reach customer service faster.